Welcome to Dr. Smith's channel. Today we're going to talk about a topic that almost everyone has heard about, but very few people truly understand: anabolic steroids and their real impact on the human body. This is an educational overview based on my practical, hands-on experience, so that you clearly understand how these substances actually work, why they are effective, and what price the body ultimately pays for that effectiveness. In this video, we'll break down the top 10 most well-known anabolic steroids, their real advantages, disadvantages, and the medical risks associated with them. First, testosterone, the foundation of everything. In one of our previous videos, we discussed natural ways to increase testosterone. But what about those whose demands go far beyond the body's physiological limits? For example, bodybuilders. In these cases, natural methods simply stop being effective. That's when injectable and oral forms of testosterone enter the picture. Well-known representatives of this foundational androgenic hormone include testovirin, sustanon, and testosterone enanthate. These compounds can fundamentally change your performance and push progress to a new level, because they directly influence muscle growth, strength development, recovery capacity, and overall work performance. These medications are predictable, well-studied, and have been used clinically for decades. In strength sports, weekly dosages typically range from 300 to 1200 milligrams, while standard cycle lengths rarely exceed about 8 to 12 weeks. However, there are clear drawbacks and risks: suppression of the body's own hormone production, acne and mood fluctuations, increased cardiovascular risks when abused. That's why post-cycle therapy is absolutely critical. Restoring natural testosterone production after a cycle is the key to maintaining long-term health. And remember this: testosterone is the base. Using other anabolic steroids without testosterone almost always leads to hormonal chaos. Second, Anavar, a steroid for control. Anavar is the complete opposite of what people usually call brutal pharma. It was developed for medical use, not for stages, trophies, or records. Its main advantage is the cleanliness of its effect. People commonly describe Anavar like this: muscles feel denser, strength increases without dramatic weight gain, almost no water retention. From a mechanistic standpoint, Anavar does not aromatize into estrogen, has weak interaction with DHT receptors, causes minimal fluid retention. It's typically used during cutting phases, most often in the range of 20 to 100 milligrams per day. It's easy to use but should never be underestimated. The results speak for themselves. With a half-life of around 9 hours, the effects last through most of the day. And because its androgenicity is relatively low, the risk of androgen-related side effects is reduced. However, one critical point must be understood: Anavar does absolutely nothing without a calorie deficit. It does not burn fat. It simply helps preserve what you have already built. Problems tend to appear with prolonged or uncontrolled use: deterioration of lipid profiles, hormonal suppression, liver strain when abused. Third, deca-durabolin, slow, heavy, and powerful. Deca is a steroid for patient individuals. It doesn't kick in within 2 weeks, but when it starts working, you feel it. Deca is significantly more myogenic than testosterone, is less androgenic, and is less likely to cause aggression. It's administered via injection, typically at 200 to 600 milligrams per week, with cycle durations of 10 to 12 weeks. Its long half-life, approximately 6 to 12 days, means fewer injections and more stable blood levels. A separate and important topic is joint health. Many athletes report reduced joint pain, improved joint lubrication, the ability to train heavier and more frequently. But there is a cost. Nandrolone strongly suppresses the hypothalamic pituitary testicular axis, can cause serious sexual dysfunction, and without proper androgen support often leads to what's commonly called deca-dick. Fourth, trenbolone when the limit is crossed. Trenbolone is a steroid that does not forgive mistakes. Almost everyone describes it the same way. I've never felt anything stronger. Whether bulking or cutting, trenbolone is usually chosen by experienced bodybuilders who want maximum results in the shortest possible time. Known as parabolan, tren, or finaplex, it's used in injectable form, typically at 200 to 600 milligrams per week, with cycles lasting from 8 to 12 weeks. It dramatically increases strength, radically changes muscle appearance, and reduces body fat. But its downsides are just as significant: disrupted sleep, psychological changes, heavy strain on the heart, kidneys, and brain. Tren is one of the few compounds associated with neurotoxicity and potentially accelerated degenerative processes. An honest medical verdict: this is not simply a harsh steroid. It is a substance with real long-term consequences, and it is used only by experienced professionals. Fifth, Dianabol, fast progress that can be deceptive. Dianabol is the steroid that created the myth of fast mass. It marked the beginning of an era when bodybuilding became associated with rapid weight gain. Known as D-bol or Danabol, it has long been a symbol of rapid progress. It's most commonly used at 20 or to 50 milligrams per day, usually at the start of bulking cycles. Its effects are felt almost immediately: aggressive pumps, strength increasing workout to workout, body weight climbing fast. This creates the illusion of a perfect compound. But inside the body, something else is going on. A large portion of the gain is intracellular water and glycogen. Estrogenic metabolites promote fluid retention, and the cardiovascular system operates under increased strain. That's why, once usage stops, body weight drops sharply, fullness disappears, and exhaustion sets in. Make this clear: Dianabol is a short-term impulse compound, and the body pays for it fast by sharply shutting down its own testosterone production, which is why proper post-cycle therapy is usually necessary. Sixth, turinabol, a smart old-school steroid. Turinabol, or T-bol, holds a unique place in the history of sports pharmacology. During the Cold War, when the world was divided into opposing camps and athletic victories carried political weight, one of the largest and most systematic doping programs was created. T-bol became its foundation, an oral compound with relatively low androgenicity, allowing strength improvements even in women without pronounced side effects. To this day, it remains valued by athletes, particularly in powerlifting and strongman, where strength gains without excessive water weight are critical. T-bol was created not for aesthetics, but for functional strength. Its key characteristics include almost no aromatization, minimal water retention, predictable and stable effects. Athletes often describe it this way: "I don't look bigger, but I'm stronger everywhere." It remains popular in strength sports, combat sports, weight class disciplines. Typical dosing is 20 to 60 milligrams per day. Turinabol is a compromise, not a miracle. It's still an oral anabolic associated with liver strain and hormonal axis suppression. Its strength lies in predictability, not explosiveness, which is why it remains relevant decades later. Seventh, anadrol, raw strength through the nervous system. Anadrol, or oxymethylone, works not only through muscles but through the brain. it powerfully activates the central nervous system. Anadrol is a favorite in strength sports. Unlike many other anabolic steroids, it powerfully activates the central nervous system, reduces perceived fatigue, allows short-term performance beyond normal limits. However, at the same time, blood pressure rises, cardiac strain increases, the liver receives a significant toxic load, and water retention. It's typically used at 25 to 100 milligrams per day, with short cycles of 4 to 6 weeks to minimize liver damage. An important point: Anadrol is one of the few anabolic compounds described in medical literature as potentially carcinogenic to the liver when abused. This is a steroid for very limited and very responsible use. It's also important to note that oxymethylone does not work for everyone. I've seen many athletes disappointed by it and getting much better strength responses from T-bol or dianabol instead. 8th, Winstrol, the steroid that does not forgive age. Winstrol is effective for athletes who aim not so much to gain mass, but to refine their physique. Thanks to its low androgenic profile, Winstrol fits well into cutting phases. Yes, muscles appear harder and veins become visible, but internally, synovial fluid decreases, tendons lose elasticity, and the risk of tears increases. That's why younger athletes often love Winstrol, while older athletes hate it. From a medical standpoint, the biggest issue is lipid balance. Good cholesterol drops sharply, bad cholesterol rises, atherosclerotic processes accelerate. Winstrol is available in both oral and injectable forms. In practice, it's typically used at 20 to 50 milligrams per day, with cycle lengths from 6 to 8 weeks. 9th, Primobolan, when quality matters more than quantity. Primobolan is a powerful, predominantly injectable compound, usually used as a finishing compound. It doesn't impress immediately, but over time its value becomes obvious. It barely retains water, avoids hormonal swings, allows for a stable appearance day after day. It's used for final preparation phases by individuals who prioritize tissue quality over scale weight. There is, however, an important nuance. Primobolan is a DHT derivative and directly affects hair follicles. Finasteride is ineffective here because the compound interacts directly with androgen receptors. Typical dosing: men from 400 to 600 milligrams per week, women from 50 to 100 milligram cycles, typically last 8 to 12 weeks. Primobolan, like Anavar, is among the most frequently counterfeited compounds, and this is a serious drawback that must be taken into account. Primobolan is a steroid for those who already know exactly what they're doing and why. In experienced hands, it remains one of the highest quality and most balanced compounds in pharmacology. 10th, growth hormone, an investment, not hype. Throughout this video, we primarily discussed anabolic compounds that promote muscle hypertrophy, the enlargement of existing muscle fibers. However, when considering maximum muscle building potential, there is another mechanism: hyperplasia, the formation of new muscle cells. Growth hormone is one of the few substances capable of influencing this process. It works differently from androgens. It doesn't provide immediate strength gains or rapid visual changes, but instead affects tissue quality, recovery, and long-term structural adaptations. Its main issue is insulin sensitivity. Without proper control, the risk of prediabetes increases, fluid retention appears, and neurological symptoms may occur, such as numbness or tunnel syndromes. Fluid retention occurs quite frequently, especially in the joints and around nerves. As a result, people may experience hand numbness, reduced grip strength, discomfort during exercise, and symptoms resembling carpal tunnel syndrome. Because of this, growth hormone should not be viewed as a primary anabolic agent. It is a supportive tool, and for most amateurs, the risks may outweigh the potential benefits. Friends, at the end of this video, I want to say the following. Anabolic steroids are not magic, and they are not a shortcut. They are powerful, pharmacological tools, and they always come with a cost. They can provide faster muscle growth and increased strength, improved physique, but they almost always disrupt the body's natural hormonal balance. That's why post-cycle therapy is critically important. Without it, natural testosterone may fail to recover, chronic fatigue, depression, and sexual dysfunction can develop. The main rule is simple. If you're not ready to take responsibility for your health, run blood tests and properly recover after cycles. Anabolics are not for you. Take care of your health. See you in the next video.